Hello, everybody. Thank you for joining us today. My name is Natalie Johnson, and I'm one of the moderators for today's program. As we get started, I'm going to provide some background on CONECTAR. CONECTAR is a play on English and Spanish of connecting, and it stands for the Communication Network, empowering communities to transform and reconnect, or in Spanish, la red de comunicación que empodera a las comunidades para transformarse y regenerarse. Although formally established in the fall of 2021, the group developed out of the need to address the urgent need to provide timely and accurate information during the height of the COVID-19 pandemic. This group of multicultural and multilingual clinicians made themselves available to provide health information at the drop of a dime. Tapping into existing relationships as well as fostering new connections with various media outlets, we were able to reach a much larger audience via channels that the audience already trusted. So who are our medical liaisons? We have three, and this program was launched through what was known at the time as the MGH Office of Equity and Community Health. We're now known as the Office of Belonging and Engagement. And these three physicians here filled the role as the key contacts for the program, representing the majority of communities we aim to reach around Greater Boston, of Black, Caribbean, English, Haitian Creole, and Spanish speaking. So we have Dr. Claude Labre, who works in MGH Primary Care, and he's sitting over here to my left, and Efrain Flores, who works in MGH Radiology, who's not able to join us today, and Dr. Gladys Pacha sitting to my right from MGH Psychiatry. So who are our multicultural media partners? As I mentioned, we leverage existing relationships as well as foster new connections with the multicultural outlets around Boston. These 5 outlets that you see here and our personalities that have joined us have long-standing presence in the community and have been able to help us disseminate information in times of need. Our team also was a resource to these outlets to provide interviews and updates so that we could make sure that the community had the information that they needed. So we have El Mundo, Java with Jimmy, Las Arceritas, Univision, and El Planeta. So I want to provide some background data on where we've been as we celebrate the first 3 years of the program. In relation to the multicultural media outlets and information that we've shared, we've consistently worked with 5 different outlets, which have allowed us to reach the Black, Caribbean, English, Spanish, Haitian Creole speaking communities. Since the fall of 2021, when this program was officially launched, to now, we've led 96 episodes across the outlets, which is pretty amazing, covering 50 and more topics. These topics range from health issues like geriatric health to social concerns such as bullying in school and cultural issues such as managing mental health during the holidays. Our audience reach has been over 500,000 with multiple modalities like print, social media, and websites. In relation to the health experts who have given their time and effort to provide patient information, we've had over 60 speakers, MGH experts providing health information. Of these individuals, they represent 25 specialties, including palliative care, psychiatry, endocrine, pediatrics, and neurology. And demonstrating the diversity of the communities that we serve, the speakers represent 10 countries, demonstrating the international representation of our audience, including El Salvador, Brazil, Honduras, Mexico, Dominican Republic, and Peru. And they speak 7 languages, including French, Haitian Creole, Italian, and Portuguese. So now that you have a little bit of background and context to the program, I want to introduce my fellow moderators for the program. In addition to myself, as the Administrative Director for the MGH Office of Belonging and Engagement, I welcome Dr. Claudia Labre, Dr. Joe Betancourt, and Dr. Gladys Pachas. So Joe, I turn it over to you.
Great. Thank you so much, Natalie. And it's wonderful to be back. I spent a great part of my life at Mass General Hospital, still a primary care doctor there, now president of the Commonwealth Fund, and to be invited back and to get a chance to be part of this conversation means a lot to me. And it probably means the most to me to do it in a place where we're coming from now, La Colaborativa in Chelsea, Massachusetts. La Colaborativa really has dedicated itself, and I'm proud to be on the board, to really saving lives here in our community, like so many other community-based organizations. And so thank you to Gladys and to Dini for hosting us, and thank you to my friends here who are around us for what I think will be a great conversation. Just by way of background, I'd say that, for me, and given where I came from, I really, really understand the importance of us being able to communicate effectively to our communities. As a primary care doctor, every day I speak to patients of a variety of different backgrounds, and there's no doubt that of all the information that's out there, some of the information that's most complex to people is health information. And so this group of people that you are about to hear from really have been courageous, thoughtful partners who really stepped up at the moment to do everything they could to give our diverse communities across Greater Boston, and I would argue across Massachusetts, the information they needed pre-pandemic, during the pandemic, and now post-pandemic, in ways that people can really take action on their health and well-being. And I think we collectively understand that knowledge is power, and the power imbalance of that knowledge really leads to a lot of the health disparities that we talk about. The fact that many of the communities that we come from, that we care about, tend to do less well as it relates to their health outcomes for a lot of different reasons. But the lack of health information has been one of them. And so we are so privileged here to be with our partners who, really said we want to be part of this work. And these are different partners who, in their own right, were well established, doing great work. One of our partners started during the pandemic that we'll get a chance to hear from. But, I'm so pleased that when certainly I came into my role in 2019 at Mass General as leading our equity and inclusion efforts, some of the people around here came to me and welcomed me and opened their arms to me. And in turn, my desire was at that time to really build relationships with them so that we could deliver information to the community. If nothing else, health is about being on the ground with people. And while I could do that in my clinical office, I thought we had a responsibility at Mass General Hospital to build these relationships and work with these trusted partners. And if you think about what the pandemic did with the amount of misinformation that happened in our communities, I would argue that many of these relationships that we built really, I think, preempted a lot of that misinformation because we were already linked around good information, I'd say, with a lot of the work that we did. These partnerships have evolved over a long time. And so let's take a chance now to hear from our partners who are here today, and maybe they could talk a bit about their outlets and a little bit about how they began in their journey. We'll want to keep it fairly short as we go around, and then Claude and I and Natalie will have questions for all of you. But why don't I start with Jimmy Hills to my left. Just by way of background, Jimmy and I met each other several years ago, actually during the pandemic. I would say that we have some more established media partners, and then we have somebody who grew up and grew their platform really out of a need and a desire also to give his community the information they needed to help save their own lives during the pandemic. So Jimmy, if we could start with you.
First of all, thank you for our hosts for being here. Our executive director is around somewhere in this beautiful place. Dr. Betancourt, I first want to thank you. Actually, I'm going to go a little bit backwards. Natalie, Dr. Pontius, thank you for your contributions to Java with Jimmy, coming to Dudley Cafe. Dr. Alabri, you ensured that that cadre of providers was available to us in facilitating as the medical director. And then lastly, Dr. Betancourt, thank you for the investment that you made in Java with Jimmy. For 18 months. We were able to share information, we were able to update technology, we were able to advertise and do things. And so just a real quick piece of how it started. Governor Baker told us to stay home on March 23rd. A week or so before that, I was kind of going live here and there, but that particular day on March 24th, I knew what we saw exacerbated in Black and brown communities around health. I just knew we were going to have that, that was going to be our experience. And so I went live, about 50 people came in the room. My mother asked a question and said, you know, will this be an everyday coffee hour? And I was like, I think so. And we thought it would be 2 weeks to 2 months. Speed things up. We did some interviews and some health information sharing before your investment, but since then we were able to pick it up. And so it is an online outlet that, you know, because of my experience and aware of health disparities, we picked it up and expanded it thanks to the support and the wonderful providers that came in, from specialists to routine and preventative care to behavioral health providers as well. And so that's just a little bit of how it got started. And at some point maybe we'll get to impact, but I will tell you that I can unequivocally say that that broadcast and that investment, it saved lives. You know, my sister, the breast cancer, Dr. Bev Moy and Dr. Rickley, there's still, though we have a different type of partnership now, there is still investment from folks to our health fair. We named our health fair now after you, the Joseph R. Betancourt Health Fair, and one of the only kind that's still happening around health. So anyway, I'll shut up because I can talk. Oh, sorry.
To the old guy now. Well, anyway, I'll be short and talking about history more than, I'm not usually in front of the cameras and in front of El Planeta face because we have an entire team doing the reporting, but I do have a huge story that I will divide it in two times with MDH, which has been an extremely important partner of El Planeta since the beginnings. In 2006, I was called by the CEO of MDH, Peter Slavin was his name. And I had two persons from my organization previously working in MDH, Araminta Romero and Digna Helena. And so Peter Slavin asked me what was my opinion about Latinos being in the ER of MDH all the time without being sick. And I explained to him that that had nothing to do with the level of education of our people. I didn't know what a primary care was when I came to the US. So there was a problem of education to immigrants about primary care. So to tell the story short, that's where Health and Family event started on Sunday in the Aganis Arena, where all the hospitals came together behind MDH, and the problem was solved. So believe in this type of work that CONECTAR is doing, because after 5 years, the problem of the ER in MGH, full of Latinos who didn't know about primary care, was solved. Community health centers started to become, in different places. And the second one is very recent, and Dr. Betancourt is a protagonista of what happened. It was COVID, and we were called by two Hispanic doctors of a big hospital here, saying that the ICUs was full of people of color during COVID, and they couldn't say that to the public. They were not allowed. So I said, can I tell your name? And I said, no, if you tell my name, I will be fired. So we went to the Boston Public Health Commission with lawyers to ask for demographic data, and we still needed somebody to come out and explain what was going on. And Dr. Betancourt was the guy who got the cojones to do that. He against his organization, corporate obligations, he went ahead, talked to WBUR, El Planeta, El Mundo, everybody was there. to tell what was going on. But we needed a voice with credentials. And so I will publicly thank you for taking that role. And then New York became a national news, Chelsea became a national news. So these type of agents of change really makes an impact. It's not only a voice of minorities, it's that when everybody is affected, like the ER of MDH was affected, the whole community was affected, it's when they need to, when I say they, the whole general market need to understand that the job that you guys do with CONECTAR has a lot of impact. That's what
Okay, my name is Angelica from Las Parceritas, and I just want to thank you for what you do and for putting this together and connecting us all. I think it's very important that we work together in what you're doing. The intentions that you have of informing the community and everyone and using all the different platforms that we work with, I think that's very special and it touches my heart a lot. I work with my sister Diana. We've been working with the community since 2009, on and off. And when it's off, people get us back on. Somehow we end up in the same path of trying to work with the community. So it's just very special to have that connection. I worked during the pandemic. I worked for Riviera City Hall in the 311. So I was able to hear a lot of necessities out there, and information, as you mentioned it, was one of the ones that we felt that it was a need. And we just saw the other newspapers, El Mundo, El Planeta, and other platforms that they got so much information out there, and we were just trying to team up with everyone, trying to get the information. And one of the things that I want to highlight is the fact that you want to reach out to some point, and we want them to reach out. So we try to everybody get together and just to make sure they know about what you're doing, and that you know that they're out there trying to reach out too. And the fact that they're getting the information from professionals, I think that's very important. They might not be able to make an appointment. They give them an appointment 3 months ahead, but then they hear information that is legit from professionals, and they feel secure. They feel that somehow they spoke to somebody. Even if they didn't spoke to someone directly, they were able to connect with someone and through any of the platforms. And I think that's very important. Thank you so much. And also I want to say that today is Earth Day. So I wanted to bring it up because I love this day. So thank you so much.
Okay, gracias. That's probably going to be the word that you're going to hear a lot. Gracias. And conectar. Esas son las dos palabras. Those are the 2 words for today, conectar and gracias. First, gracias, obviously, for this institution, MGH, which, on our platforms, I'm sure all of us have at one time or other reminded our community that this is not just one of the best hospitals in the city. It's not just one of the best hospitals in the country. It's one of the best hospitals in the world. And prior to COVID, I will tell you, you're 100% right. There was no connection to the community. There was very little conexión, conectar. So, of the many ill things that COVID has brought, there are a lot of things that have come through that I would say are positive and we can build on. And the fact that Dr. Betancourt, which was the catalyst, you proved a couple things. That one person can make a change because you went and you relentlessly then went to, you had a voice, and then you gathered all of these Latino doctors from all these different countries that we didn't know, we didn't have a connection, okay? ¿Tú cuántos años llevaba? My whole life in Boston, had never known Gladys. Now we're like buddies, right? Plus Efrain and all the other ones, right? So you connected the doctors to the community and the hospital to the community in different platforms, right? And in different communities. So I think that this is an example that should be modeled around the country. So you need to keep doing this. You need to keep expanding what you started. Just like this building before COVID, this didn't exist. And we're talking about how beautiful this is. So this program is something that I know you have the support of us, your partners, but keep doing it because you are making a major impact on so many different levels. You're connecting, and there are so many people grateful. So, gracias a ustedes y a todos los doctores.
Well, thank you so much, and I appreciate those introductions. I'm going to just maybe say a couple of quick things, and I'm going to turn over to Natalie, and we have some questions for all of you. But what I really want to say is thank you back, because it is the fact that the community trusted you that allowed us to then come and earn their trust through your platforms. I mean, I'll never forget, when I started my position, Tibisa Isaiah came from El Planeta to interview me, to talk about, what types of things I was thinking about very early on. I was on your TV show. Those things mean a lot to me. And then the pandemic gave us an opportunity to begin to engage and support Java with Jimmy, with Your Healthy Java, did 1 million Facebook Lives pre and during COVID on Planeta. We created En la Hora del Café, Un Minuto de Salud. We supported Las Parceritas. And then the beauty is that, thanks to Natalie and thanks to these doctors who, again, people like Claude, Fen, Gladys, you mentioned something very special, which is we have so many doctors who want to give back, but we didn't have that vehicle to make it easy. And so this was about connecting passionate, committed supply with real strong demand, and you all the glue that made that happen. So I can't thank you enough. And I also say, you mentioned, Jimmy, about support, and I think it was really important for us and for me, especially given how challenging it is right now to be in media from a resource standpoint, and how important it is that you all are given not just people resources, but the financial resources to be able to kind of bring this information to people. You can't do it for free. And my continued message to organizations like MGH is that these relationships are important, and they can't be built just on goodwill. They have to be supports and sponsorships. This is, you help me, I help you. That's what we do this together. And I'd end by saying that in this era of misinformation, we learned so much during COVID. And I think the only way we will counter misinformation is by overpowering it with good information. And your outlets allow us to do that in ways that are unprecedented. And absolutely, this group of people here, I will say it shamelessly, we saved lives, but we did it together. We did it together every day, one person at a time, one story at a time, information in ways that the community was able to hear it from people who looked like them, who spoke their language, who understood them, who shared their lived experience, and that your kind of trusted relationship was a way for us to earn that trust. So I thank you. I'll turn it over to Natalie now, who will ask a little bit more about CONECTAR and what this has meant to connect these caregivers with your outlets. And then, we look forward to hearing more stories about what this has been like and from the standpoint of impact. So Natalie, I'll turn it over to you.
So I'll start with Alberto from El Mundo asking, how has being part of CONECTAR impacted you and El Mundo?
Well, the obvious one is you make me wake up at 5 in the morning every day for La Hora del Café, which started, that was a show that, I don't know if you remember, many years ago on the radio when Mercedes Barnett, Vivia. So right after COVID, we started just like you, Jimmy, right? It was just Ali and I and then Nati starting La Hora del Café, and then we formalized it, said every day. And then you called us. We didn't call you. I don't know what happened to you guys, but he called me and he said, hey, I'm watching this that you're doing every day. How can we be a part of it? And then we developed Un Minuto de Salud, which is 1 minute of health every week, every other week now, on air, and it gave you an opportunity so that I could meet the doctora. I can't remember the first time you were on. Okay, memorable moment. She was talking about something very serious, and she was in her house, and there was a door behind her that looked like it was opening and closing, and I was getting nervous. I said, who's behind that door? What does that lead to? And that's what everybody remembered. They said, oh, the doctor with the stairway to who knows what. You remember, right? But it allowed us to meet so many different physicians who, like you, were donating their time, because that's important to say, to get up at that early. These wonderful doctors were then in great spirits. So to me, it's made me very proud to be Latino, to know that we have from all different countries, Peru, Venezuela, Cuba, Puerto Rico, Venezuela, but at the hospital. So to me, it's been a sense of pride because I love Boston and MG, one of the best hospitals in the world, and now the voices and faces that I'm seeing are very Latino. So it was very, very proud for us.
Same question for you.
Thank you. So I think it impacted me personally, the fact that we were able to meet wonderful doctors and people that are giving information so valuable, and the fact that we are able to provide this information through our platform. So I think it's a big impact because we can see the people that we work very close with the community in different events, and they ask us about the different segments that they were on with the information. There was one about the schools and the different habits with the kids, and that was one of the ones that we got a lot of phone calls. They wanted to know a little more, and sometimes we just send that little segment to them so they can have the whole thing. So I think it's a big impact because through little information, it affects different people, and people learn different things. Maybe a certain group might not be interested in one thing, but then they hear something else through another platform. And I think just the fact that the doctors are giving this information, it really comes from the heart because they don't have to do it, you don't have to do it, but you're doing it because it's genuine, you want to inform, you want people to know, and we want to provide also that information to them. It's like we're so excited to get this information, but now, naturally, we want to also pass it around because we work with the media too. So I think it's so important what you're doing, and we're very grateful, and it's just a big impact. We want to keep doing it and keep doing it because in health, there's only learning every day. There's always something new. There's always information that is valuable and that can really save somebody's life just through information. And that's why we thank you. And it's an honor for us to be part of this.
Thanks, Angelica. And you brought up a good point about the information on multiple channels, and that was something that we were aiming to do is just keep repeating it, have the same topic on all the channels so that regardless of where people are going, they're going to find it and know that it's true.
Well, I'll just, I would repeat what Alberto and Angelica said because I'm completely connected and encourage and embrace what they said. The only thing that I would add is that you guys make a difference doing this. No other hospital is doing this for decades of our work in this community. So we need you to keep doing it. And as Dr. Betancourt said, this is a win-win, but at the same time, we need resources in order to do it better. And we can go together and pitch for those resources. And I'm pretty sure other hospitals will come and contribute. We also own an outlet in Washington, D.C., and we just told Johns Hopkins that they should do it as well, because we don't have connection with the Hispanic doctors in that entity, which is extremely important and worldwide recognized. So congratulations for making a difference and keep doing it. And in whatever way we can help to keep this, make it sustainable, we're here for that.
I would say, for me, the impact is definitely personal, as I alluded to before. There's my baby sister who got a lot of advice and information when she was ending cancer, but mainly my aunt, who was involved with the cancer center. I was telling Dr. Betancourt in the back there, and also yesterday we got a chance to break bread, that the impact of the investment reverberates beyond our relationship formally with MGH. Ended about a year ago. But with Dr. Betancourt, you went from a funder to a friend. And so that impact is there personally. I believe I know for sure on the macro level, at the health fair last year, people walked out with recommendations for medical plans and black men that were told because they didn't have a certain type of history or whatever that they didn't need prostate exams and to be screened and whatnot. Oh no, they went back to their doctors and demanded to be screened. People had went into therapy. People had lost weight. People are addressing diabetes. I mean, every show that we did and covered, and some repeated just to get the information. Natalie, I want to make one point clear. Though on the tech end, we have to clean some things up with our website switch. Your Healthy Java is evergreen. It is on Facebook, Twitter, Instagram, YouTube, and my website. Well, not the website, but it's out there for people to go and get the information. As you said, you would send the videos, and so the impact is personal. The impact is powerful, and I agree that the sustainability and the resource of what Dr. Betancourt mentioned in that long term. And I'll also go ahead and say that a lot of the relationships that are done in community oftentimes are done with the individuals. And an entity really needs to take into consideration its commitment as an entity that if individuals move on and do bigger and different things, that those relationships be maintained on a macro level, though often established on a micro.
I think Jimmy actually just spoke to that effect. We're going to ask about impact in the communities and the viewers, which you mentioned with some examples. I was wondering if the other net platforms could also speak to the impact that this relationship has had on your viewers, because you probably have the strongest connection to the communities than we do, and some other networks might. So we can start with.
So I think one of the impacts to the communities will be the confidence that they have now getting the information, because it's the same information, it's coming from professionals, it's coming through also valuable media platforms. So I think the confidence that they're feeling to approach now is a little more different, is better. And they're going to feel now like a family, they see each other in their faces, they're going to feel connected, like we're all human beings, we're all together in this, and we have to work as a team. The doctors, as well as the media and the community, so I think we all together, you're practically hugging us all, and we're letting us do it, because it's important that we all feel connected this way. That's why I love the name CONECTAR. It's perfect, because that's what you do, you're connecting the media platforms, you connected the community with the resources, and somehow you get a little circle of love there. So I think it's very important, and the impact is there. We feel you, and they feel you. So is getting there. And that's why we, as Javier said, I think it's so important that you keep on doing it, because not a lot of people do this. A lot of, sometimes you see doctors are so unreachable. And the fact that you're doing this is showing them that you care, and we love it, and thank you so much for that.
Well, I think we saw it, what really shone a bright light on it was COVID. That was the game changer. We had always heard about these statistics here when you met with Slav. It was, well, this is a theory, why, it wasn't as concrete. This one hit us in our face. When Chelsea became ground zero for COVID, when Governor Baker, who later became very active, at first had no idea what was happening in Chelsea, and it was through La Colaborativa and what was going on here in ground zero that the entire state, the entire Commonwealth realized too that so goes Chelsea went the rest of the state. So when the COVID was going very high in Chelsea, they know that was the way in state, and that was the way in Chelsea, right? What essential workers were. That was a new term that really came out during COVID. People that continued to work during and through COVID, they lived right here in Chelsea, right? The density, the housing situation, how many families were living and one person was contaminated, and the next day 40 people were, because it was this domino effect that would have in the houses, right? So all of that came to light during COVID through what we'd call this new health disparity that we had always talked about, but this was, you couldn't now deny it. It was in our faces. And when MGF stepped up with La Colaborativa, with his Boston Neighborhood Health Center, with La Parceritas, all of us, with Planeta, El Mundo out there, we, the Latino media, now became more important than the general market media for the first time ever. Because they don't read the Globe, they don't watch Channel 4, they don't listen to BZ Radio. You know, what was great because you had the doctor with us on La Hora Café. Then you had it with you. Then I was here at Planeta, right? Then you started coming around with the English side, right? So it was this multimedia approach that really worked because our community, you have to tell them 10 times over and over and over. And you took an approach, you didn't go with one way, with one media, you really diversified and made sure, and then on the ground, right? You accompany that with actually being on the field. How many times did we have your team, you and your teams, out here in La Colaborativa, in Chelsea? So to me, like I said, COVID was horrible, but the silver lining is we have learned, we talk about the state of Massachusetts, a lot about the importance of communities that traditionally have been not ignored, but at least put in a second and third tier when it came to getting the message out. People used to think, oh, and you know, the Red Sox learned this too when we started doing the concerts with Bad Bunny. They were used to announcing Lady Gaga or Taylor Swift, and within 1 week, it was sold out. 34,000 people. Bad Bunny, we had 34,000 people, but 50% bought their tickets the last month. It still happened, but it's these trends that now, thanks to all these things, they're being highlighted more, that there is a difference and there's a different way of messaging and things get done differently in our communities. It's very important.
I think the way you guys are framing CONECTAR is extremely efficient because it's not only experts talking to unexperts. It's bottom up, top bottom. And I have a perfect example of how this worked. During the vaccine campaign, our people were not getting vaccinated. And a lot of different explanations were surrounding it. But religious was an important part. And I do remember a conversation with Dr. Betancourt. We called him and told him, what's your religion? And he said, I'm Catholic. Well, I need you to talk like a Catholic here. So this is the expert listening to us on what we wanted him to explain. And it was so good. I mean, I really asked you to go and search on El Planeta, Dr. Betancourt, during COVID. And I remember after that, one of the biggest Christian evangelical church, León de Judá, called for a vaccine campaign in their church. So that made this type of work that you guys do make an impact, but don't lose that real connection. Because sometimes doctors and medical institutions are so strict on the amount of information that can be given, but if that information comes back and forth, the impact is very, and there are already cases about it.
I just wanted to add, though I started it, the main thing I think that there was a consensus across platforms when you talk about the impact, not only the knowledge of the medical information, but one of the key things that we always made sure we did was give folks the, I don't like the word empower, because if you empower, you can also kind of disempower. We gave people the power to understand that they had a right, that not only to have the knowledge, but if they said something to a provider and they weren't getting the response that we told them that they should get, a lot of people refer to the fact that I went into my doctor's office with this and I advocated and they said no about a test and I stayed on the phone with my insurance company to get approval. So it's the knowledge of the medical information, but it's also the power. Empower is a trendy word, but
The agency to.
Thank you. The agency to stand up for their own health equity. So there's the macro that we're all speaking to, but folks also walked away with the micro as well.
That's great. All right, I think, yeah.
So I want to just say a couple things here. I'm actually going to let you ask the next question. One of the things that I think is really critical in communicating with the community, and I think you mentioned this, is humility, right? The humility to not act like you own all the facts yourself. During the pandemic, we saw this, right? Information changed from month to month. I think one of the biggest challenges that created a lot of mistrust among the community is when they'd hear a doctor come up with certainty and say, this is the way it is, and then 2 weeks later it would change. You told me I'd get the vaccine, then I wouldn't get COVID. And, you know, people lost trust. And I think what we tried to do was have the humility to communicate and say, this is what we know right now, and it can change. And this is about sharing this power with you. Because I think that's where that humility to go where people are, to figure out what's important to them, to understand. I mean, I think that was our communication philosophy. And I was pleased that you know, CONECTAR came together as people who had that kind of understanding of, you know, knowledge is power, but we share knowledge together. You have a lot of knowledge. You deal with your lives every day. So I just want to reiterate that point because it's nice to hear that. I think that should be a key ingredient going forward, especially because we know that the pandemic is over, but people are frustrated. Care is not affordable. Care is difficult to navigate. There are capacity challenges in our hospitals. So this work isn't done. Long COVID, I mean, this work is not done. And I always used to say during COVID, I hope we have the courage to bring these lessons forward because the same challenges just present themselves in different ways. And your partnership, you know, what we've built, I think, is the foundation for a lot of different things. And whether it be Facebook Lives, whether it be radio, whether it be shows, whether it be print, you know, I think we tried to spare no strategy to get on the ground, in community. We tried to spare no strategy to have those linkages. So I'll turn over to Natalie now, and Natalie, maybe we can pivot to kind of the future and maybe feedback from viewers.
So the next question that we have is, how can we, as CONECTAR, better improve meetings and engagement with the community based on feedback that you've heard from your viewers or even amongst yourselves at your outlet? So I'll start with
You know, to say, how can you better? Well, just keep doing it. That's one of the things. That's it. I think you're doing the right approach. It's been very well supported, and the viewers are connecting. They are listening. I will say just continue to be more consistency when it comes to having the doctors to, you know, get together and give this work. I think that is a big impact because, like I mentioned before, the confidence that the community has listening to you is very important. They feel safer even though they just heard the information. And then they pass it to their families and then to their friends. So one person will pass the information to their surroundings, and that consistency in the information and to keep going, I think that's one of the things that we have to keep strong. Yeah.
We've heard from doctors, and I know this is the most difficult part, but it could be very powerful, is keep in mind to look for great testimonials from the community. People that are willing to talk about, there are people who are willing to talk about how they have controlled bipolar. You know, they're not embarrassed. There are people who were willing to say, you know, I didn't think of going to get my prostate, and then I got checked, and this helped save my life. So my suggestion would be to start developing a strategy for identifying patients who might be willing to tell their stories. Are you willing to share your story for the betterment of the community? Because like you, there's probably thousands out there. And then then you go through the whole legal stuff, but really harness that power of, I think that I know my community. People are willing to share, maybe even more than the general public. The general non-Latino public is very concerned about privacy, but our community, if you tell them and explain and they're willing to share, they will tell you. They will tell you. But if you do that, I think that could be a level up.
Well, to encourage more Hispanic doctors to go on and talk to us. Because as Dr. Betancourt and everybody here knows, the COVID was one that impacted everybody, but there are many other things. I'm seeing El Mundo with the mental health topic very, very specifically putting deep emphasis on that. That's a topic that we all have to encourage MGH to dig more on testimonials and Hispanic doctors to be vocal about it, and other topics. So and I think we should meet more and to understand what the community it's living, and the typical cancer, cardiovascular, diabetes, and mental. If we focus on those four that are keep killing people, and try to do more on CONECTAR, that will be the feedback that I could give to you.
I would be remiss if I didn't say that MGH needs to make the investment and put a center in Nubian Square. That is something that I think goes beyond this, not to take anything away from this, but having the information and going somewhere. We know that transportation, the MBTA, well, anyway, we know that transportation is always, can often be an issue for people to going into care, and I've seen a few places where MGH has popped up, and so Nubian Square is thriving. It is close within community and a central point. The other thing I would say, and I think part of this is what we've heard from community, I mean, you're missed. People mention you. Dr. Alabre, and not maybe so much on screen, but not be alluding to, I talked to him or thank Dr. Alabre for making that arrangement. We do have an iteration or form of Your Healthy Java that is still continuing, but the partnership just really brought a lot of value, I think, to that knowledge piece. And it set a tone, I think, within our city and region that we have a right to good health care, that though we know about the disparities and the social, I mean, people now are having the conversation differently about social determinants of health. Like, it's not a misnomer and it's not a taboo. Like, it can be a part of everyday coffee table, no pun intended, conversation. And so the impact from the community is figuring out how we expand and do more. And again, going back to the point, it sounds like I may be the only relationship that's in the past, but the sustainability that is needed, and then also appreciation of the providers and staff that make this stuff happen. And the last thing I would say is the commitment to policy within every practice that is not only front-facing with the patients and the public, but also in the back office. And understanding that a lot of these businesses are small businesses, women-owned, Black LGBTQ-owned, Black and brown-owned, BIPOC-owned, and so even in the back office, that policy, because to have all this investment made and there not be sustainable change in policy, for me, is for naught. So, just my humble opinion.
I was wondering, Gladys, if you want to say a few words just about to you. Yeah, well, I would just say, just a little bit about Gladys, because we haven't talked about her, but just so you all know, I had a chance to meet Gladys when we created the Spanish language care group at MGH. Gladys was one of the first people who stepped up, and that group was about making sure that there was always a Spanish-speaking doctor on every surge team during COVID. And Gladys not only did like the most shifts, day, night. We went to the convention center. She was the first one to go there. So Gladys was brave, she was courageous, she was on the ground, and it's so wonderful to have her, kind of lead this now with Efren. These are people who care deeply about our communities, our Black and brown communities. And so Gladys, it wouldn't be right if we didn't hear some thoughts from you today.
Well, it's an honor for me to have you here. It is really so much to talk about CONECTAR, really. So many things accomplished already, but so many things to do still. I 100% agree in terms of the need to change in terms of our authorities, our people who manage bigger things. We are really working in the change. We are very committed to this, to doing CONECTAR. And also the doctors who work with us are very committed, very proud of the work they do. And the next steps for CONECTAR is really expand. My dream is to be able to, like you said, to come to the community in person, right? Now that we are able to come to the community, different events, and talk with people, because one of the core beliefs of CONECTAR is the communication that needs to be bidirectional. We need to provide education and information, but we also need to talk with people and say, what do you need? What do you need to know? What do you want to know? What do you don't know? Sometimes people don't even know what they don't know. And so it's important to go to the community and really talk with them, talk with people. What do you need? I'm here. It's amazing how people respond when they are addressed by people who look like them, who talk the same language, the same culture. It is not just the same language, it's the same culture. We have our things, and it's really, I have so many anecdotes that to address these cultural differences. I don't know if I can say one of them. I always say this, it's the same anecdote, but I think it's so simple, but it was so touching to me. I went to one of the floors during COVID, and one of the nurses approached me and said, this lady doesn't want to drink anything, like nothing. She's not drinking for like 2 days, and we don't know what to do. So they start IV, but she was able to drink. She didn't want to drink. So I'm like, what do you offer? Well, just water. So I went to talk with the lady in Spanish and said, so, ¿qué pasa, mama? And she's like, well, I'm coughing. I have a respiratory infection. I can't drink cold water. And, that's going to be worse for me. So what if we just give you some warm water? Oh, that'd be great. So I told the nurse, and she brought warm water, and she started drinking. Just, that's very simple change that was because someone was, I know my mom, she doesn't drink cold water when she has a resfriado, right? So we understand that was the connection right there with this person. So there are so many things that we still can do, and they are not really complicated things. They are like things that we can just address in when we see patients every day, or when we go to the community, when we go to the grocery store. Sometimes I start talking with people there, and it's just so great. So there are so many things to do. Thank you so much for being here again. It's a pleasure to work with CONECTAR, with Natalie, with a friend, with Paul. Joe, thank you so much for everything you did at MGH. You really set the tone, and we just need to keep going.
Thank you. Yeah.
Sorry, he was mentioning the impacts your platforms had on the community. One of the things I kept thinking of is the difference I felt, at least, with the health fairs, being there in person. And I don't know if the Spanish language platforms have ever done any in-person events or plan to, because for some people that's a whole other level, to be there in the presence of these physicians who are from their communities, as Gladys mentioned, know their cultures, to be there. I mean, the fact that we got so many people registered for bone marrow donation at the first health fair was just remarkable. People who you never met before and who had never been heard of research or wanted to participate in anything, and all of a sudden they're willing to donate and be part of that day. I don't know if you guys want to speak to sort of any in-person activities or plans or what you've done so far.
It's about resources. It's about resources. In order to do this well, impactful, and at the level like this building is, like what Gladys has built here, which is a top-notch, the community is in need of top-level events of if it's health, I think Alberto has done tremendous well on this type of things on events. But health events needs resources. When we did health and family a long time ago, we had Ringling Brothers in one stage. We had 5 hospitals. We replicated the board game Life. Remember the board game Life? So we did the path of life of different health topics. And then the kids were having, the New England Aquarium and the Ringling Brothers. So it was the Aganis Arena. It was, something, but it was with resources towards a specific target, which was ER collapsed. They had an ER collapsed rooms that they want to solve that. So that was the. So if the work of CONECTAR is done properly, which is understanding the need of the community, like what you said, Doctor, then you come and design a good event. Because the persons who are here, we can have it, we can build it, we can do it efficiently, but we need the resources, and you guys have to put in order, what are the needs and how to tackle, and what the results you want. Because it's not only having a bunch of people there. What's the data you're going to get from there? And right now is so much needed. The immigration problem right now in the country that is impacting Massachusetts, it's going to be seen, the problem is going to be seen in health soon, unless things like what you're saying are done.
I could just say that. Oh, go ahead.
My favorite day of the year is going to be June 9th. And I'm going to invite you because you're the only one that doesn't know about the event. He was there. He knows. We have an event this year called Tu Salud. It's at Fenway Park. It's free. Jimmy, you were there last year. And MGH does a phenomenal job of activation. They have the doctors there. You are 100% right. There is nothing that replaces face-to-face. There's nothing. So we would obviously promote that the doctors were going to be there. They got to see the folks. So I share with you 100% your assessment that there's nothing better than face-to-face. And you guys are, you're a major supporter of it. You're a major participant of it. And that's my favorite day, the community. As a matter of fact, I want to thank Gladys, because last year they sent like 4 bus loads from La Colaborativa over there. And this year we want to do more. We were just talking to her. So it's a free event. So it's just getting them there is the biggest challenge.
I would say for me, the first and second year, MGH was heavily involved in the sustainable and support of the health fair. I have to shout out, and I hope it's okay, through a partnership through the MGH Cancer Center, Dr. Rick Lee had garnered support from Jensen to be a major support. And so MGH was there with the tables and things like that. But if it wasn't for that level of support, we have to be able to, we gave out a lot of gift cards and whatnot to get people there. I put registration up today, and we did raffles, and we gave away customized pair, well, we forgot last year, but we're giving them away this year, customizable pair of sneakers. But people, there was a line. When we opened the door, there was a line out there, and so that sort of model of a health fair, you don't hear about it too much anymore in community. And so we're committed to keeping that alive. It bears the name of Dr. Betancourt. And so, all of you are invited to come and table. We're already talking about tables. And that in-person thing, I think, is huge. Even when we did Dudley Cafe, and this will be the 3rd year that we did. And folks got the vaccination. They got evaluated blood pressure checks. They had to get a COVID test in order to get the vaccination. So they got COVID tests. They got a whole bunch of information and walked away with all type of information and goodies and whatnot. So May 11th, plug, is the health fair from 11 to 3 p.m. at 575 Warren Street at the Thelma Burns building in Roxbury. So we'll make sure everybody has that information. And the van comes as well from MG8. So they're already on standby to be there. So
I think we're at the end here, and I know we want to just show a couple of slides to show where we can find each of your outlets. So why don't we just pass the mic around? Start out with you, Alberto. Just a bit about your outlets. I mean, people will be able to see this slide, but
At El Mundo Boston is where you find everything, Facebook, Instagram. your YouTube. And tomorrow morning at 7. But you don't have to tune in at 7. You can tune in anytime during the day to watch the show. It's a 1-hour show. That lady right there with the white shirt is the producer who gets all of the guests. She does the majority of the work for each show. So who do we have on tomorrow, Nati?
We have the Cambridge Savings Grant.
Financial Tuesdays.
And Josiana.
Josiah Martinez from ASG. And today we had Tony Molina.
Tony Molina. We have a duo of like comedians from Colombia, La Águila Descalza. And we have the 3 girls that travel to represent Florence and Dominican Republic in Colombia in a softball game.
Yeah, so Tony Molina was on, who was the first Hispanic injured in Vietnam War. And we had him on because yesterday he says he celebrates his 2nd birthday. That was the day he got shot and survived. That was 59 years ago. 59 years, so we had him. We had 3 young ladies who represented the Dominican Republic, but they were from Lawrence. And they traveled to Colombia for a softball tournament. So we had the catcher, the pitcher, and the outfielder on. And then we had, what was the last one? Oh, yeah, this comedic troupe from Colombia that's known all over. And they're coming to the Lynn Auditorium, as you know. Very funny couple, so yeah.
Yeah, well, elplaneta.com, it's a content machine, it's a news provider machine. We have 31 people behind it, and 4 reporters in the city. The El Planeta Boston in Instagram is very active, very engaging. I was telling my friend here that the whole organization has changed. An average age 28, 29 years old. I'm being pushed out, but and we also have a WhatsApp, very impactful WhatsApp group. I think I share a QR code that you can see. You can just go through the QR code. We have about 3,000 people, and all locals from Boston. And it's a great way as well to be on the alert of breaking news and sometimes investigative reporting. Yeah. So don't be surprised if there are investigative reporters of MDH stories too.
I was trying to find, I have an all-inclusive like Linktree one, but I don't know where it is, it's somewhere. So we have Java with Jimmy on all social media platforms, as it's spelled Java with Jimmy, Instagram, Facebook, Twitter, Java with Jimmy TV on YouTube, and then personal James W. Hills on Facebook. And so that's where you can follow me. We're on every Monday through Thursday at 9 a.m. Sometimes a special one on Fridays, and then every once in a while we do a Java After Dark.
Las Parceritas, you can find us at lasparceritas.com. And we also have Instagram and Facebook and also Twitter. And we throw an episode once a week, and we try to promote it through the social media. We also have a monthly bulletin with important information about the show, but also about what's coming through the month, as long as it's for the community, and if it's free for the community, we post it there.
Excellent. Yep. All right, yeah, where I could be found now is, I still see patients at MGH a half day, so I'm still there, but now also president of the Commonwealth Fund. It's www.commonwealthfund.org. We just released a very big report last week, picked up in a lot of media, our health equity report across all 50 states. So we did a health equity analysis of all 50 states. And just quickly, so you all know, there's not one state out of our 50 states and Washington, D.C., who has achieved health equity. Minority populations do less well in all 50 states and in the District of Columbia. Number two, even among the highest performing states, including Massachusetts, as we all know, still have disparities. But number three, there are things that we can learn from states that are high performing. And I'm pleased to say that, a couple of things that we could share with the nation actually are things that we do here in Massachusetts. We have a strong social safety net. We really focus on the social drivers. We really do a lot around health insurance, and so we're one of the states with the lowest uninsured rate in the nation. And we have things like this. We have people who are very, very committed to equity in the community, so there's a lot that we could learn from what we do here. And we don't have it right yet, and that's the beauty of, I think, Massachusetts and all of us, is that we don't give up till we have it right, and we still have a long way to go. So I think we're at the end of the show here. Yep, and so I'm going to turn it over to Claude for a couple last comments, and then...
All right. So, this has been really awesome. I think the underlying sort of lesson here has been trust, which I just keep hearing from everyone in terms of having this presence in your communities and what difference it makes. And really the only reason it's making a difference is because of the trust. I think that the community has had in the platforms, in the people that are represented on your platforms. And so this sort of undertaking, as you know, needs extension. And I think we've all talked about ways we can sort of further the endeavor. But looking at how we have at least taken the first step towards that equity and sort of pushing is great. As you mentioned in the report, it's not the same everywhere. I think it's good to know that we are still sort of at the forefront and pushing. So right now, I think what we'd like to hear more is sort of what the viewers are giving feedback on. We had sort of had a survey.
We just wanted to highlight some of our work over the last 3 years.
Over the last 3 years, yeah.
Some slides and some pictures.
So they have been all different, I think, but similar in terms of education, sort of outreach via different platforms. We have Gladys Efren, who's not here, working mostly with the Hispanic population, and then Jimmy here, who did a couple of years with me on health education every first and third Tuesdays. Didn't forget. And so that is sort of the way people were getting information, and the health fairs are continuing. We have one coming up, which you just mentioned, and we're trying to have a presence there as well. And Gladys and Efren are still continuing with the platforms that they are working with. If you want to speak, Gladys, quickly, how often are you doing?
So right now we have, hello. We're working with El Mundo twice a month. It's going to still be the second and fourth Wednesday of the month at 7 a.m. El Minuto de Salud. And we are coordinating with El Planeta and Las Parceritas for the next segments that are TBD.
Great.
Go ahead, Paul.
Sure. And so with Natalie, actually had a poster presentation recently at the American Public Health Association's conference. And do you want to speak a little bit to the impact what happened there?
Sure. So it was a really great opportunity to meet individuals from all across the country who are focused on public health, and to be able to share the work that we were doing. And a lot of individuals who stopped by the poster mentioned how impressive the work was, and were asking about what was the model that we used. And I was like, we were flying by the seat of our pants. What's the model? We recognized that there was a need, and we did what we needed to do to meet it. And so we were able to share what we've done, and like Gladys mentioned, where we're going to go next.
Okay, this was the first part of the celebration that happened a couple weeks ago, where the moderators were part of the medical liaisons. This was in Spanish. I was not able to really fully follow everything. I watched for a little bit on that. But then again, we have had so many speakers, so many people who have volunteered their times. The entire Java with Jimmy and most of the other platforms are really all volunteer-based. People who are donating their time to come and speak with the communities and share information and connect. And so that was certainly worth celebrating, where they all got together and sort of reviewed and reflected on the last 3 years of the work that's been happening. Okay, and so this is the sort of currently now for Curitiba. Sorry if I butchered that word. What's that? Yes. And so that was the website, and then we have, yeah, you can go. So Natalie is the administrative lead for CONECTAR, and Gladys is the physician lead. Also still thinking, I think every time we meet once a month, hearing her plans and all the things she really wants to get going and doing. There's only so much you can do at once, but the will is there, and I think the mission is very strong. And so this is the CONECTAR team. We have Gladys again, Efren, who was not able to be here, myself there, and Natalie, who really is all of it. And so she is keeping us all connected and doing everything. This, as you can tell, she was devoted to putting this together for Minority Health Month, and has been relentless at getting this project going and getting connected with the community. And this is our information for the website there, MGH CONECTAR at mgh.harvard.edu.
And I know that we had put up the slide about La Colaborativa, but we really wanted to say thank you to Gladys and Dini for making this space available to us and for the amazing work that they do in terms of supporting the community in this new survival center and giving people the resources to better themselves and to get connected with whatever resources that they need. So thank you again to Gladys and Dini for all that they do.
So we'll close it out. Thank you all so much. Thank you for those who've tuned in. We really hope this was interesting. And most of all, I just want to say thank you. Thank you, Alberto. Thank you, Angelica. Thank you, Javier. Thank you, Jimmy. Your courage, your connection to the community made this all possible. So, we couldn't have done this without you. This is all about partnerships. And I really want to thank Claude for jumping in and really being part of expanding the work that we did. In cross-cultural communities, particularly with Jimmy, and then Gladys with the work that she did, really leveraging El Planeta, El Mundo de las Parceritas, and absolutely Natalie, who's just been really behind the scenes and anchor here. So onward, we go onward. This is a great celebration of the past, but we are excited about the future, and I want to thank you all, and thank you all for joining us. Take care, everyone, and we'll look forward to seeing you in the community. Thank you.
Thank you.